Good evening. How is everybody doing? It's Dr. Nicole, DO, board certified family medicine physician, and baby, it is cold outside. Tonight here in South Carolina, it is supposed to get down to a low of 25, and you guys know that that is unheard of. I always tell people I moved to the south to get away from weather like this, but apparently I didn't move further south enough, but it actually doesn't matter tonight because it's going to be dropping down into the 20s and 30s all the way down into Florida. So what does this mean for you? Well, anybody that has joint problems or joint pain or has a joint is going to tell you that during the cold weather, their joints tend to ache a little bit more. Remember back when our grandparents used to say, I can predict the weather, I know a cold stretch is coming, I know rain is coming? Well, let me explain to you why that is. So, in all of our joints, we have something called synovial fluid. Synovial fluid is like the body's WD-40. It's there to help coat the joint, which is how it's supposed to work. The problem is when we have arthritis or when we have a lot of pain and pressure on the knees or whatever joint that is, we make more of that synovial fluid. Think of it like the squeaky hinge is the one that gets the grease, all right? So the squeaky joint is going to get the synovial fluid. Synovial fluid will thicken and get crystals in it when it gets cold outside. So when that fluid gets thick, it's kind of like a slurry. It's just hard to move, and then it swells. We have joint capsules inside of our joint. So this capsule fills with fluid and it swells, okay? So that's where the pain and pressure comes from. And then it's almost like, it feels like a water balloon sometimes in your knee or in your joints. So they get stiff, they get cold, they get achy, and they get swollen, and they get warm sometimes, and they get hard to move. It's because it's cold outside, and that's why your joints ache more in the cold, okay? Also, barometric pressure. So when it's raining outside, that barometric pressure is also pushing on the joint, which also makes the joint more painful as well, okay? So this is why we ache more when it's cold and why we ache more when it's rainy. And this can be anybody. It doesn't have to be just old folks or just grandma and grandpa or just mom and dad. This can be anybody, especially people that have injuries, especially that people have a history of arthritis, and especially people who have a family history of arthritis, okay? So when you know it's going to be cold outside like it is tonight, this is where you need to be proactive and you need to do some things in advance before the cold weather hits. Okay, so I'm going to tell you what those things are. First, let me explain to you real quick, what is inflammation? Inflammation has 5 signs: redness, heat production, pain, swelling, and decreased motion. Let me do that one more time. Swelling, heat production, pain, decreased motion, and redness. All right, those are the 5 signs of inflammation. So when our joints get inflamed, that's what happens, all right? So what causes inflammation? Things that cause inflammation: injuries, okay? So if you were a football star, a track star, in the military, you could have more inflammation in your joints. Other things that cause inflammation is things in our diet. So there are 3 main inflammatory foods: dairy, gluten, and sugar. Let me say that one more time: dairy, gluten, and sugar. So I have my own clinic, Abundant Life Concierge, but I also work part-time at the Arthritis Knee Pain Center, all right? And so this week after Thanksgiving, what am I seeing more of? More swelling, more arthritis, more pain, more redness, more fluid in the joints. Why? Because during Thanksgiving, we were all eating dairy, macaroni and cheese; gluten, the noodles and the macaroni and cheese; sugar, sweet potato pie, okay? That peach cobbler. All of these things that taste so good are the things that cause inflammation. So today I got slammed at the clinic. Why? Because we were eating more inflammatory foods over the weekend, and now people's knees are paying for it. Not to mention, it's also been colder than usual, and it was wet and rainy here in South Carolina yesterday as well. So you've got 3 things: the weather, your diet, and then rain, that are causing more inflammation. So what do you need to do? Well, first of all, try to lower the inflammation from an inside, things that you're taking in. So limit your dairy, limit your gluten, limit your sugar. You need to drink more water. I tell my patients all the time, you got to lubricate the joints, all right? Lubricate the joints So drink lots of water, and when you think you've drank enough water, drink some more. The next thing is motion is lotion. So you've got to move the joints. I know it feels like the Tin Man in the Wizard of Oz, and it just hurts to just move them. But the more you move them, the better you're going to make some more of that synovial fluid, and the better things are going to start flowing. All right. So you got to move, you got to drink your water, you got to limit your inflammatory foods. Next thing you got to do is take your anti-inflammatories. What's an anti-inflammatory, doc, you might say? Well, there's lots of different ones, and you can get these over the counter. Now, your doctor can prescribe them for you as well, and please check with your doctor before you start taking an anti-inflammatory. Anti-inflammatories are not without side effects, even the ones over the counter. They can cause problems with your kidneys, problems with your liver, so always check with your doctor first. But some of the main ones that you can grab over the counter, even tonight as we get ready for this cold stretch, acetaminophen, also known as Tylenol. Get some, all right? There's regular strength Tylenol, there's extra strength Tylenol, there's arthritis strength Tylenol, all right? If you don't have any problems with your liver, you can take up to 2 grams of Tylenol a day. The easiest way to break that up is 500 milligrams. You can do that every 6 hours, all right? So you can take 2 500 milligram Tylenols every 6 hours. Another great anti-inflammatory, as long as you don't have problems with your kidneys, is ibuprofen. All right, also known as Motrin, also known as basically ibuprofen or Motrin. All right, great anti-inflammatory. Over the counter, they come in 200 milligram tablets. All right, you can take up to, as long as you don't have problems with your kidneys, up to 800 milligrams at a time. Please, guys, don't do more than 4 of the over-the-counter ones at a time. All right, and you need to take that with food because it can jack up the lining of your stomach. All right, so you need to take it with food. Now, what I tell my patients to do is to alternate Tylenol and your ibuprofen. You do the Tylenol, 1,000 milligrams. 4 hours later, you take your ibuprofen. 4 hours later, more Tylenol. 4 hours later, more ibuprofen. All right? That is if it's safe and it's approved by your doctor. There are prescription strength anti-inflammatories that you can also take, things like meloxicam, naproxen, Mobic, all kinds of ones that come from your doctor that you can take as well. So be proactive. Now, you don't want to take those anti-inflammatories like naproxen and meloxicam along with ibuprofen. They are all affecting the kidneys and all affecting the lining of the stomach, so you don't want to overtake those. Now, let me tell you about something natural that you can take. Turmeric, all right, also known as curcumin. Turmeric or curcumin. Turmeric and curcumin, it's a natural plant that's grown outside. What about Dr. Nicole always say about plants? If it's grown as a plant, you can eat it. All right, it's safe for you. All right. Now, turmeric is 6 times more potent as an anti-inflammatory than ibuprofen, and it does not have the side effects. It does not affect your kidneys. It does not affect the stomach lining. Now, what you might see if you're taking turmeric is that your urine might turn a little yellow. That's okay. Drink more water. All right. So get you some turmeric. Again, it's 6 times more potent than ibuprofen, and it will do your joints good. Listen, Dr. Nicole takes turmeric every morning. In fact, I was going to show you guys the bottle of turmeric that I actually make and sell, but I'm out of my bottle. So it's in the comments. It's in the info section in the link there. There's a link. It's called Abundant Pain Support. It's actually a special blend of 3 different types of turmeric. But Dr. Nicole takes 2 turmerics of those Abundant Pain Supports every morning. I take 2 every morning. All right. If I'm hurting, I might take 2 in the morning and 2 in the evening. If I'm really, really, really hurting, I'll take 2 in the morning, 2 in the afternoon, and 2 in the evening, all right, before bedtime. So this is how you can beat inflammation. There's other things that can beat inflammation, things like ginger, things like black pepper seed oil, things like cayenne, okay? These are all in the Abundant Pain Support. Get you a bottle today, all right? Get you a bottle today. And for the rest of the week is Giving Tuesday, so I'm going to give that to you all. Use the code ALC and get 15% off through the rest of the week. ALC, get 15% off of the supplements, all right? So, take your turmeric, all right? It is more potent as an anti-inflammatory than ibuprofen, and it does not jack up your stomach. Now, I'm going to tell you one other thing that I tell my patients to do when they are hurting and in the joints. I want you to get a piece of gauze, okay? I want you to take your turmeric capsule. You're going to open it up, okay? This is called making a poultice, Poultice. Okay, you're going to be careful with turmeric. It stains. It's the same thing that we put in curry. All right, so it's going to stain. So you take the turmeric, open it up, and put it on your gauze pad. Okay, like I'm making a mess, but you're going to take your turmeric, put it on the gauze pad. Then you get whatever gel that you use. I love to use the joint and muscle gel. It's also in the comments. Again, use coupon code ALC and get 15% off for the rest of this week. All right. So joint and muscle pain rub. It's a great pain rub. It has menthol and some other things in it. All right. So you take your turmeric, you take your pain rub, and you're going to make a little paste. Okay. Then get something to stir it. I just use a Q-tip. You're going to make a paste out of this. Can you see? Okay, so I'm making a paste. See it? All right. And then you're going to take this turmeric paste that you just made, and you're going to apply it to your joint. Usually it's the knees that people feel most during the cold weather. So you're going to take this paste, apply it to your knee. Okay? So just take this, boom, put it on your knee. Okay? And then you're going to take an ace bandage and wrap it up. All right? And then get a heating pad, apply heat to it. Okay? This is a great way to keep the joint warm overnight. What did I tell you? If the joint gets cold, it's going to freeze up in the synovial fluid. So you want to keep the joint warm. That will also help this turmeric and the pain support gel to absorb into the body through the skin. All right, so it's a great anti-inflammatory. My mom does this every night, and it helps with her knee pain, okay? That's the best way, I would say, to address your knee pain. All right, so you know it's going to be cold tonight. It's supposed to drop down to 25. I want you all to run to get the link in the comments, but mine won't be here tonight. But if you need to run down to the drugstore, over the counter, get some. Remember I said it stains? You see how yellow my hands are? So just know that turmeric does stain, but it's a great anti-inflammatory, okay? So tonight, I want you to get your anti-inflammatories, all right? I want you to ice your knees. Ice is help to bring down inflammation, and then the heat is going to help to keep it warm overnight when the temperature drops. And then the heat also helps to relax the muscles so that it can have less muscle aches and muscle cramps, okay? Other things that we can do to help with joint pain is weight loss. Now, you guys those who follow Dr. Nicole, you know that I have lost 175 pounds over the last 13 years or so. And when I used to weigh 370 pounds, I couldn't go up the stairs of my house. My knees hurt so bad, okay? And I promise you, I lost the first 25 pounds or so, and all of a sudden I can go back up the stairs in my house again. Every pound of weight that you lose takes 5 pounds of weight off of your knees. Let me say that again. Every pound of weight you lose takes off 5 pounds of weight off of your knees. So weight loss is an excellent way to help knee pain. And a lot of that can be done, most of that we can do through our diet. Again, eliminating those inflammatory foods, dairy, gluten, and sugar. That'll help with weight loss and also helps bring down inflammation. Okay, I know this was a lot, but I wanted to come on because, like I said, it's going to be 25 degrees tonight. So I wanted to give you some tips on how you can beat arthritis pain and joint pain tonight when it drops down and gets cold. Let me go through it one more time. Take your anti-inflammatories, whether that's Tylenol, whether that's ibuprofen, or whether that's some turmeric. All right, go ahead and order Abundant Pain Support, which has 3 different blends of turmeric in it and black pepper seed oil, some other things. Make yourself a poultice. Remember, the poultice is a mix between turmeric and whatever gel you have. It can be arnica gel, which is an anti-inflammatory. It can be some camphor and menthol. It can be some hemp gel. This is all the stuff I keep in my arsenal, y'all, okay? Especially when it's going to be cold like it is tonight. This is the stuff that I use. Make yourself a little poultice. Put that on your knees. You know, ice it first, then put this on your knees. Wrap it with an ace bandage, and then heat it up with a heating pad. That will help lock in the heat so that the joint fluid can't get as cold overnight, okay? And make sure you're drinking plenty of water. One last thing, vitamin D. What we have found is that people who are deficient in vitamin D, they hurt more in their muscles, in their joints, in their aching, all over their body. So make sure that you get some vitamin D. All right, D3, K2 actually helps the D to absorb better. All right, but get you at least some vitamin D3. How much vitamin D should I be taking, doc? Well, if you've never had your vitamin D level checked, then you can safely take 1,000 to 2,000 international units a day and be safe. You're not going to go too high on that. If you've had your vitamin D levels checked and you know that your vitamin D level is less than 20, okay, then you need to be taking 10,000 units a day for the first 2 to 3 months, right? If your vitamin D level is between 20 and 40, you need to be taking 5,000 units a day for the first 2 to 3 months. And if your vitamin D level is above 40, then you are safe to do 2,000 units a day, okay? Vitamin D levels, they can get too high. We like them to be anywhere between 70 and 100 if you can get them that high. I can tell you this now, most people in the South, vitamin D is too low because we don't get enough sunlight. When you don't go out in the sun, that's the best way to get vitamin D. If you don't go out in the sun, then you're going to be vitamin D deficient, and then you're going to ache in your bones and your joints. So get you some vitamin D. I'll put the link in the comments too. For my vitamin D, I've got 5,000 units. I've got 2,000 units. I've got 1,000 units. I've got chewable ones. I've got all kinds of ones in Abundantly Natural. That's my pain support line. And again, use the coupon code ALC. That's the way that I'm going to give back on Giving Tuesday. Use coupon code ALC and get 15% off. I'm going to let that run through the rest of the week, okay? All right, guys. I've got to go, but I want you to stay warm tonight. Keep those joints lubricated. Motion is lotion. All right. Take your anti-inflammatories. Please stay warm. Please stay warm. Please stay warm. And if you know anybody that doesn't have a place to stay, please help them find a place to go tonight because it is going to be brutally cold tonight. All right, guys. I'm Dr. Nicole Edwards, board certified family medicine physician. I just wanted to come on and share this with you. Why do my joints ache so much in the cold? I explained it to you. It's because that synovial fluid gets thick and it causes swelling. 5 signs of inflammation: pain, heat, swelling, decreased motion, and redness. All right. You guys can follow me on all social media platforms at Dr. Nicole DO. That's DrNicoleDo. Follow me on YouTube and look out for more tips. And I will talk to you guys soon. Stay safe out there. Bye-bye.